while I try this slideshow, because all y'all PowerPoint experts in here, you know what I'm saying? Once again, ladies and gentlemen, and if I can presume, since we're all involved in working for the betterment of our brothers and sisters who are lesbian, gay, bisexual, and transgender, to address some of you here as colleagues, and some of you as friends. Today we gather for what I believe, and so far no one else has come forward to convince me otherwise, that this is the first ever summit looking at mental health of our lesbian, gay, bisexual, and transgender brothers and sisters of the other colors of the human rainbow. Those who are black, African American, Afro-Caribbean, Afro-European, Afro-Latino or Latina, or African, Asian, the Indian, Native American, or as some of us from South America would say, Amerindian. These members of the same human race are the ones who are often vilified just for who they are, for the color of their skin, but also for how they feel, their expressions of their sexuality and sexual orientation, who are part of the spectrum of human sexuality, but who were, are, and will continue to be discriminated against. Some of you have chosen to attend this conference convened to look at the relationship between the construction of God's and black sexuality at Columbia University across the river. In fact, you've chosen to come here, and we are extremely grateful that you've actually chosen to do that. The reason we are here this morning is pressingly important. Events occurring daily in the New York, New Jersey tri-state area, the Atlantic region, across the country, and around the world demand that while we use technology, as our youth will discuss later, to communicate and obtain information, we are asked more and more to step outside of ourselves and provide assistance to another. For lest we forget, none of us live in a bubble. Each of us is dependent on another and on the other. Today is groundbreaking. This is a start. We are scratching the surface of the complexities which make up our human sexuality and our psyche. But the question we ask ourselves is, how can these two be reconciled? Today, in a discussion moderated by Chris Adams, who was here earlier, we will look at the internal processes involved in a person coming out, which is, as well as asking the community for acceptance, is more of accepting oneself for who one is, wholly and completely, with the risks and consequences of that acceptance. Reverend Rose Hardy will help us to examine that potentially dangerous confluence of religion and mental illness. How religion, religious belief, religious practitioners have superseded in many cases and supplanted the natural workings of the person's psyche, replacing it with a belief system that encourages dependency, slavishness, and obsession. Our moderator for another panel, Farah Tanis, will attempt to examine the many issues lesbians of color have to struggle with, given the natural and societal pressures against which they are fighting. And notwithstanding, we have our young people among us, for whom we who are older relive the tensions of longing to return to being young and wanting to pass on what we've learned through trial and error, to help them not make the same mistakes we made. Many of our young people, especially those young men between 13 and 29 who have sex with men, whose HIV infection rates, according to the CDC, has plateaued at an estimated 50,000 per year, but for whom the messages of safer sex, condoms, testing makes us stronger, have become the equivalent of white noise, background chatter, which is often ignored and labeled of a past time. A discussion led by Leah Jackson and with the assistance of Brian McGovern from NJCRI will attempt to delve into this and look below the surface at the networks and support systems our young LGBT do not even know are available. And this is especially against the backdrop of many using drugs and abusing it as a way to cope and to manage. What are they coping with? What are they trying to manage? Then Reverend Kevin Taylor will attempt to examine the myriad issues which our transgender sisters and brothers struggle. Many people and organizations have come together to make this summit happen. Many have worked hard, given of themselves, their time, money, and effort because they believe, because they feel that the mental health of LGBT people of color is ignored, that they wanted to do something tangible about it. We extend thanks to Chris Adams, Thomas Wilkie Placido, who's here, Marion Greathouse, running around somewhere, and Nikita Correa, her assistant, to the Rutgers LGBT Diversity Center, Leandro Rodriguez and Mauro Gulka from the Latino Commission on AIDS, Dr. Wilhelmina Perry from the Faith Leaders of African Descent, Dr. Jeffrey Gardier, who's going to be here later on this afternoon, to our own Gary Paul Wright, somewhere sitting in the back, and to Sheba Simpson-Sampson from Amsterdam Cleaning Service to help us clean up when you all are done. Angela Allerby from Double Exposure, who's helping us with promoting the event, this summit, and to Tree Alexander and the team of volunteers from both the Rutgers University campus and those he was able to bring. But we are acutely aware that there's a host of psychosocial and social cultural issues that we have not and we are not going to be able to touch on today. But we hope to raise these issues at a conference next year, a bigger conference. There are issues of the mental health of our LGBT brothers and sisters and transgender who are incarcerated. There are mental health issues of those who are in the foster care system. There are mental health issues of those who are LGBT and seeking asylum in the United States. Those are some of the issues that we cannot even begin to touch on today because we'll be here for the rest of the weekend. And I know some of y'all really get tired of my voice already. But you understand what I'm saying? This is why this summit is so important. Can anybody in this audience tell me if there's ever been, in their experience of going to conferences, HIV, all sorts of related stuff, has there been any event that focuses on the mental health of LGBT people of color? So do you understand the enormity of this? Now before I hand this microphone, it's a clip-on, to Thomas, who is a young black gay man who I am proud to introduce, who just graduated with his master's and is very committed to the work that we are doing. Before I introduce him, he's going to set the tone for us for today's event. I'd like us all to just spend a moment in silence. Take a moment and bring to mind those people you know who have committed suicide, who have died. Those people you know who are struggling with depression and other forms of mental illness. Those people you know who do not know how to ask for help. Let's bring them to our minds. So, ladies and gentlemen, I now have the pleasure to introduce Thomas.